Thank you, everyone. I'm joined by the Minister for Health and Aged Care, Greg Hunt, and Professor Skerritt, who heads up the Therapeutic Goods Administration. I said several weeks ago at the Press Club that our top priority this year was to roll out the vaccination program here in Australia. This is an enormous exercise. There has been meticulous planning undertaken for an extensive period of time to make sure we get this right, so that Australians can have absolute confidence in the program that has been rolled out here in Australia. The vaccination program is critical to our ongoing management of the COVID-19 pandemic. The vaccines that we have, they address the critical issue of serious disease and indeed the risk of fatality that can arise from COVID-19. And increasingly we're seeing positive signs about its impact on transmissibility as well. This is an enormous exercise which requires many steps: the planning of the strategy, the securing of the vaccines, going through the important approvals process which can give Australians confidence. I said this morning, when we take our children to be vaccinated, it's Professor Skerritt who says that that vaccine is safe for your children to take. This is the same Professor Skerritt who's telling you when it comes to these vaccines that they're safe to take, and it's in your interests and the public health interest of the nation. And so that's why I'm pleased to say today that the Therapeutic Goods Administration has today approved the AstraZeneca COVID-19 vaccine for use in Australia following a full and thorough assessment process. The vaccine has met requirements for standards for safety, quality and efficacy, and will be provided free to Australians. And it means that Australia now has 2 safe and effective COVID-19 vaccines available. Initial supply into Australia will be imported from overseas, and in the coming months the AstraZeneca vaccine will be manufactured here in Australia, as the Minister for Health and Aged Care and I visited the facility in Melbourne just last Friday. And that will mean Australia is one of few countries in the world that can manufacture its own COVID-19 vaccine here by CSL. Our vaccination program is on track. Our vaccination program has the backing of Australia's best medical experts, and that means that we can proceed along the path that we have set out, and I look forward to working with all the states and territories and medical health professionals across the country, those involved in the logistics supply chain, to ensure we can get this out right across the country, and it's going to make a huge difference to how we live here in Australia this year and in the years ahead. I'll pass you on to the Minister for Health.
Thank you very much, Prime Minister, Professor Skerritt. AstraZeneca is cleared for liftoff. And what I can say is that the TGA has approved the AstraZeneca vaccine for use in Australia on the basis of all ages and a second dose at 12 weeks. They've taken the best advice from around the world. They've also had the opportunity to examine the advice and real-world evidence gathered from the emergency use provisions in other countries. In particular, the Lancet Journal said very recently in an article published on the 3rd of February 2021, COVID-19 vaccine AstraZeneca confirms 100% protection against severe disease, hospitalisation and death in the primary analysis of phase 3 trials. That's the Lancet. And then overnight, the World Health Organization, in its statement for authorisation of use, noted that the AstraZeneca vaccine was shown in clinical trials to be safe and effective in preventing symptomatic COVID-19 with no severe cases and no hospitalisations more than 14 days after the second dose. Now, the world will obviously continue to gather evidence on safety and efficacy, but from the Lancet Journal, from the clinical trials, from the World Health Organization, the strongest possible advice. Our Australian officials have taken advice from the United Kingdom. What that means is that the vaccine rollout is on track. Yesterday we mentioned the Pfizer vaccine. I can confirm today that we are expecting at least 240 aged care facilities to be included in the vaccine program next week. And that's a very important step forward in protecting our older Australians. The AstraZeneca vaccine, on current advice, we hope and expect that it should be able to commence, subject to shipping confirmation, which we can now proceed to, in early March, if not earlier. And then, of course, we moved to an increase in total numbers with the CSL Australian-made AstraZeneca vaccine due, subject to TGA approval, to commence in late March at 1 million doses per week to be made available. So that program will help keep Australians safe. And then finally, I would note that around Australia we have seen 2 new cases of community transmission, both within Victoria, both already on the advice I have within isolation, 7 states and territories with 0 cases, and a total of 55,000 tests around the country at a time when we know that there were 374,000 cases and 8,200 lives lost, sadly, around the world. So our containment is strong, but we always have to remain vigilant. The vaccine rollout is on track, and today's another important milestone. I particularly, John, before asking you to speak, want to thank you, all of the team at the TGA that have worked extraordinary hours to tick every box, to assess everything, to make sure that safety is the number one priority. They and our medical professionals and all of the companies involved have worked literally around the clock for a long, long period. Thank you.
Oh, thank you, Prime Minister and Minister, for supporting the work and the announcement. So this is the second vaccine that we have approved for COVID-19. We're also the second, only the second regulator in the world after the European Medicines Agency, with whom we work very closely. We have a preferential, long-standing collaborative relationship, and it's been strengthened under COVID times. But we're the second major regulator to have actually done a full conditional approval of a vaccine. There's a number of other countries, such as the UK, you're familiar with, Brazil and so forth, who have authorised this vaccine in emergency authorisation. And as the Minister said, just overnight, the World Health Organization confirmed its support for an emergency use listing for this vaccine. They also confirmed a couple of things that I want to tackle head on, because I know that they've been the subject of some discussion, both in the medical fraternity and in the media. The first relates to age, and our approval for this vaccine does not have an upper age limit, while the data for this vaccine in older groups is limited. And that goes back to the original design of the trials, where AstraZeneca targeted their initial trials towards healthcare workers who obviously are generally of working age and usually under 65, and only included older people later on. But our analysis of the data gives us no reason to suspect that the vaccine would not be fully efficacious in older groups. Secondly, the experience in the UK in the rollout, and we've got to remember that they have been vaccinating with the AstraZeneca vaccine now for more than a month. And their experience is also of very good results obtained with both of the major vaccines in older groups. And of course, their rollout has been targeted not only towards frontline health workers, but also towards those in what the British call care homes. So there's real-world evidence of the vaccine going well in older groups. And also there's evidence from blood tests looking at the response of the immune system to these vaccines, which again shows a strong immune response in people over 60, people over 65 and so forth. Yes, more data on a lot of things will emerge as months and weeks and years go by, including the duration, how long these vaccines actually provide protection for. But on the balance of the evidence, we have no reason, and we felt there was no reason to limit its use to particular age groups. The second thing I want to tackle head on is efficacy, because a lot has been said about this vaccine. And as the Minister said, a recent study just published a couple of weeks ago in Lancet, one of the world's top medical journals, showed from a more detailed analysis of trials, because as time goes on, you have more people who may or may not get COVID from these trials, more people whose data can be assessed for safety and performance of these vaccines. and it showed 100% efficacy against severe disease, illness and death. More importantly, it showed that when there was a 12-week interval between doses, and this is what ATAGI, the advisory group, has recommended, but there's 82% at least protection from those groups. And what's important with that 12-week interval is it seems that if you leave it more and more weeks, that you do get greater protection. And frankly, there's not a difference when you go into the real world between whether something's 82% or 90%. So I would emphasise that a lot of this discussion of numbers is not particularly relevant. What's important is to get vaccines into people's arms. And the AstraZeneca gives us a vaccine that can be used not only in major facilities, but also in primary care through GPs and potentially through pharmacy practices. And having a vaccine that's accessible in a country as wide and brown as ours is absolutely important. All this information has now been published, and if you do go to the TGA website as well as the main health department website, you'll see that information. Finally, I'd just mention a little bit about pregnancy and vaccines, because as a group of international regulators, this is something that is obviously keeping a lot of us thinking. Now, like many clinical trials, vaccines are not tested in pregnant individuals, whether it's a new medicine or a new vaccine. Generally, if you're known to be pregnant, you can't volunteer for a clinical trial. It's just a safety measure, a precautionary measure. However, there were a number of people who didn't know that they were pregnant or became pregnant during those trials, and there haven't been reports of adverse outcomes. The other thing that regulators worldwide are doing is recognising that, especially in countries like the UK, especially in the US and in Europe, some of those hospitals cannot afford to take their pregnant nurses and doctors off the front line when they're in a crisis situation with a sheer number of cases. And so many of those people have exercised personal choice by being vaccinated, and they're being closely followed in a register. Now, obviously those babies have yet to be born and so forth, but again, there's no evidence of anything untoward, such as miscarriage or illness during pregnancy. But as the weeks and months go on, we'll also know a lot more about pregnancy with these vaccines. The aim, of course, is as time goes on, we'll know more about the vaccines in all the groups in the community, including children. And I'd also just like to close by saying that each of the major vaccine companies has now commenced studies either in adolescents or in some cases in children as young as 6. Thanks very much.
Well, thank you, Professor Skerritt, and thank you again to you and everyone at the TGA for the extraordinary job they've done for their country over these many, many months. Seek your cooperation as usual, because we have Professor Skerritt with us. Why don't we focus on the vaccine and the announcement first? I'm sure there are other issues you'd like to raise and we can address those then. So on the vaccine, David.
Science, and possibly Professor Skerritt could answer this one too, but he mentioned that there was a stronger efficacy with a 12-week delay between the first and second jabs. I thought we were heading towards a rollout that was a 3-week gap. Is that changing? What's going to be the approach on the gap?
So the 3-week gap relates to the Pfizer vaccine. The recommendation on the gap for the AstraZeneca vaccine is 12 weeks, and that will obviously add complication to the logistics. And this is something that the rollout team, part of our same Department of Health, that we've been meeting just today. Brendan Murphy and I and the others met to discuss that today. Now, what we said at TGA is you could give the second AstraZeneca jab anywhere between 4 and 12 weeks, because let's say, sadly, if you had to start cancer chemotherapy in a few weeks' time, you might want to bring that jab forward. So it's efficacious as soon as 4 weeks after the AstraZeneca, but the recommendation routinely is to leave it 12 weeks.
Come back across this way.
Professor Skerritt, the TGA information on the jab says it should be a case-by-case basis for older people. You've just said that there's no upper age limit. Can you explain what that means, and should older people get the AstraZeneca vaccine?
So we recommend that older people should get the AstraZeneca vaccine. The wording case-by-case, I guess, relates to a discussion of really, it comes down to what old means. I'm 61. When I was 40, I thought 60 was old. Now I've decided 61 is very young. And so old is always in your mind. To be fair, what I'm going to get into trouble now. To be fair, we were aware, and there were reports globally, of deaths in Norwegian aged care facilities. Now, it turned out that, sadly, hundreds of people in any state or territory die per month in aged care facilities of what we used to call old age. And so the issue about old people for any medicine or any vaccine or indeed any surgical procedure is look at what doctors call futility. If someone only has a few weeks to live, you don't give them a hip replacement and you may not give them a vaccine or a medicine. So that's where we're hinting at. But the vaccine is recommended for use in all ages.
Given the 12-week gap here, does that mean that to reach your goal of having everyone vaccinated by October, you would expect every Australian to have had at least their first jab by the end of July? And if I may, Professor Skerritt, how does that gap interact with people getting the flu vaccine? Do they have to wait till they've had both doses, or could they get it in the middle?
I'll let Professor Skerritt deal with the second question, and then Greg can deal with that.
I'll talk with respect to the flu vaccine. Again, this is an issue which has occupied the minds of regulators worldwide. Because we're wanting to identify whether there are particular adverse events related to the COVID vaccines or the flu vaccines for that matter, if you give both of them together, you don't know which one may have caused the problem. Not that we're seeing significant problems. There's well-known issues such as headache, temperature, sore arm and so forth, but nothing that seems to be really very serious. And so at the moment, it's recommended that you have your shots 14 days or so apart. So if, for example, you're in a, phase 1A group, if you're, say, a frontline quarantine worker or whatever, and you have your shot in the next couple of weeks, we'd recommend them to wait a couple of weeks till they have their flu shot. But they don't have to wait till the end of 12 weeks or the end of both shots to have their flu shot.
Just in terms of the timing, what it means is that more Australians will have more vaccines earlier. That's a happy byproduct of the decision. It also means that we are absolutely on track, so every Australian who seeks to have the vaccine will be in a position to have had at least the first dose. We'll look at what it means with regards to the second dose, but frankly it's very, very good news. It means higher efficacy, it means more Australians earlier, and it means a position where every Australian who seeks to have it will undoubtedly have had their first dose. We'll now remodel what it means in terms of the tail, but I would say it doesn't mean we're on track, it means we're ahead of schedule for where we intended to be.
One here and then we'll come over.
Can
the
only
side.
deal with 12 weeks.
Sorry, just on the AstraZeneca vaccine for over 65s, are you breaking away from precedent in terms of the lack of data? Would this have been approved if we weren't in a pandemic?
No, we're not really breaking away from precedent. It's perhaps not well known, but many vaccines are actually approved on what are known as immunological correlates, in other words, analyses of blood samples. So let's use the seasonal flu vaccine. As many of you will know, every year, because the flu vaccine mutates or drifts, so the flu virus mutates or drifts so much, we need to bring in a new flu vaccine. Sometimes it's got 4 components. Sometimes one changes. In a bad year, 2 or 3, we've never had all 4 change, thank God, but 2 or 3 can change. So it changes every year. Now, we simply don't have the time to wait till a flu season happens to see people get the flu and whether the vaccine works. And so we use a lot of tests with blood and cell samples. And so it's quite well established in vaccines to look at that evidence from blood and cell samples. And it showed quite a strong immune response in the over 65s. And so it's very similar to what we've been doing with other viruses, such as the flu virus, for a long time.
Okay.
If we had either one or both of these vaccines last month or the month before, like we have seen in other nations, Melbourne would still be in lockdown, other state capitals would have gone into lockdown. And with that in mind, was it worth it to go through the slower approval process rather than going through the emergency approval process?
I appreciate the question. Firstly, there has been no slow approval process. This has been, I think, the most efficient and timely process that the TGA, I think, has ever undertaken for any vaccine. And they've done it in a way which has cut no corners, ensured every inquiry that they would have undertaken in relation to a vaccine would have been undertaken. And that was the safest way to conduct that process and to arrive where we're at today. So the option of doing something different was not present without putting at risk the safety of the process. That is sacrosanct, I think, to the effectiveness of the vaccine. And let's not forget that the significant success that Australia had over the course of last year in comparison to other countries created the space. Australians created the space for Professor Skerritt to be able to do the best job that they are capable of doing. And I've got to tell you, Australia's TGA's best is the best in the world. And so that enabled them to do that. So that was the right decision. That was the right decision to do that. And that's why we proceeded on that basis. Phil.
I've just got one on IR. Could I ask about IR?
Unless there's vaccine questions, because I'm going to excuse Professor Skerritt. Yeah.
We're obviously dealing with something new in terms of a multi-dose vial. What wastage are you building into supply? Because obviously we're oversupplied by raw number. And are there any circumstances in which you can envisage a particular person getting both vaccines?
So, as you've mentioned, the government has procured many more vaccines than the whole population of Australia requires, and it may well be that we're in a position to share them with our Pacific neighbours in the coming months, if once we get to a situation of vaccine rollout in full swing. In terms of wastage, this is something that the group working on the rollout is very focused on, and I won't steal their thunder by going into detailed strategies, but they have detailed strategies to make sure that there's going to be enough people present and available, for example, to use up the entire Pfizer vial. One of the advantages of the AstraZeneca vial, and that's why I said earlier, it's important to remember that approval of the AstraZeneca vaccine will really help with people getting vaccinated, because this is a vial that can go, if you use half an AstraZeneca vial in a GP's practice, it can go back in the fridge overnight, and then it can be used again the next day. You don't have to throw it out. So there's a lot of advantages to this product, including less wastage.
And also, are there any circumstances in which someone can get both?
Well, we're encouraging people, and this is a consistent message globally, we're encouraging people with your 2 shots to have 2 of the same thing. We don't have a crystal ball, and what we don't know is, especially with the emergence of variants, or maybe these vaccines provide 2 years protection but not life, whether in 2022, 2023 people will have to have a booster. No one knows that. Again, it's something that we're looking at fairly closely. The immune response seems to be pretty durable, but there's only one way that we'll know next year whether people have to have a booster, and that is wait until next year. It may then be that a different vaccine is ideal to use as a booster. There actually are some trials starting in the UK and 1 or 2 other countries where they're deliberately using 2 different vaccines to see how well that combination works.
Professor Skerritt, people who've already had coronavirus, will they be receiving either of these vaccines? And Prime Minister, today Victoria's announced it's going to be building its own quarantine facility, which could spell the end of hotel quarantine. Given that we've just approved 2 vaccines and we're starting the rollout, is something like that necessary, and will you be providing any federal assistance?
Well, Professor,
I'll do the first one short. Again, the advice, there's no advice saying don't have it, and of course in Australia we're fortunate that the numbers are fairly small. But a number of other countries are vaccinating people who have had coronavirus. There's no adverse event. In fact, what they're suggesting is that some people may only get off with 1 shot, because in a way what the vaccination does is give a further boost to the natural immunity you may have had from catching the disease. But time will tell with Australians. That's one area that our hospitals and doctors will carefully monitor. They'll take particular interest in people who have had coronavirus and then they give a vaccination to.
Thank you, Professor Skerritt. I've got the other issue. Of course, we'll work with the Victorian Government, the New South Wales Government, the Queensland Government on all these issues, as we always have. I mean, we've provided significant support to all the states, particularly through the Australian Defence Force. And when it comes to supporting those quarantine arrangements, in New South Wales, they've operated hotel quarantine at triple the capacity of when Victoria was actually open. And they've been able to do that quite successfully through hotel quarantine. I note also that the New Zealand Government, which doesn't operate as a federation, have also consistently used hotel quarantine as the most effective way to enable people to come back and for those facilities to also provide an appropriate quarantine period. But we'll continue to work with states on these issues as they wish to pursue them, also seeking to get as many Australians home. Should stress international travellers are not allowed to come to Australia. Australians residents and citizens are allowed to return home, and that's what we're seeking to do. In many of these cases, we look at these as supplementary capacity to hotel quarantine. It is true, even though on an international scale the number of incidents in the Victorian situation are few, they've of course had a pretty significant impact, particularly last year. But it is also true that in 7 other states and territories they've had great success in managing that inflow and also preventing both breaches, but where breaches occur, their systems have been very strong, whether that's in Queensland or Western Australia, or of course New South Wales or other places. But we'll work with them, as we always have, and I know the Victorian Government has always appreciated that support. Yeah.
Prime Minister,
Greg?
are you saying they should not be used to replace hotel quarantine but complement it? And
work with the Victorian Government, that's all I said, Greg.
Are you concerned that Victoria, through this announcement today and through the language of Dan Andrews over the past week, that he is shifting away from a preference for hotel quarantine?
Well, that's just not clear yet based on the information that's in front of us, but the objective, the task doesn't change. Our focus as a government is, of course, on delivering the $6.5 billion vaccine program, and that's where the Commonwealth has been putting in our effort around these issues, and we've worked with the states on the many other issues. So 2021 can prove to be a far more open year than 2020 was.